Hello, my name is Dr. Mortensen. I'm an anesthesiologist for YADAYADA. Many people ask, what should I be telling my anesthesiologist? If I come in for surgery, I've never met him before, how much can I tell him or should I tell him? It's important to tell your anesthesiologist about medications you take. It's also important to tell them about supplements. For example, ginseng, ginkgo, ginger, these can all make you bleed more. So it's important to include those supplements in your discussion with your anesthesiologist. Obviously, you want to talk to your anesthesiologist about health problems you have, or sicknesses, or things that run in your family. You also want to tell your anesthesiologist if you use any drugs. We don't judge patients. It's important to be open and honest with your anesthesiologist. A common question is, can I smoke marijuana the morning of surgery? We do not advise that you smoke or use marijuana. It is important for us to know if you regularly use it, because if you regularly use any form of marijuana, it can increase the amount of anesthesia you will need in order to stay asleep. It's also important to tell your anesthesiologist if you use tobacco. You'll want to tell your anesthesiologist if you have smoked the morning of surgery and roughly how many cigarettes you use each day. It's also important to talk to your anesthesiologist about your alcohol intake. 1 drink a day really should not affect your anesthesia requirements or side effects from anesthesia. However, if you consume more than 2 drinks of alcohol a day, that could increase your need for the amount of anesthesia required to keep you asleep. If you drink the morning of surgery, that could also decrease the amount of anesthesia you need to stay asleep. So it's important that you talk to your anesthesiologist about the amount and timing of your alcohol intake. It's also important to talk to your anesthesiologist if you snore, or if you have sleep apnea or use a CPAP machine. This will help your anesthesiologist know how easy it will be to help you breathe while you're asleep. Another important topic to discuss with your anesthesiologist is if you have ever had a heart attack or a stroke. Both of these are increased during and after surgery and receiving anesthesia. By knowing the timing and severity of your heart attack or stroke, we can help modify your anesthetic. It's also important to tell your anesthesiologist if you've had a bad reaction in the past to anesthesia, or if a family member has had a bad reaction to anesthesia. One serious problem is something called malignant hyperthermia. This is a severe reaction to anesthesia that runs in families. You might have an uncle or an aunt or a grandparent or a parent or sibling that have had malignant hyperthermia. It's crucial that you tell your anesthesiologist about it. In this condition, while you're under anesthesia or receive certain types of medications, your body can go into what we call a hypermetabolic state, where the amount of carbon dioxide you breathe out increases and your temperature rises. We have specific treatments for this, but we need to know that you're at risk for it. We also have very good ways of preventing it if we know you're at risk. Your risk of malignant hyperthermia is about 1 in 100,000, so thankfully it is very rare. Remember, you may have never met your anesthesiologist until the day of surgery, but we care about you and we want you to be safe.